Phosphatidylserine has many vital functions throughout the body's tissues and organs, but most importantly, it's a key building block for the billions of cells in your brain. Phosphatidylserine is produced by the body, but we get most of our intake from food. When food isn't enough, or we have a greater need for this vital molecule, supplements are then another option. It's used as a natural treatment for Alzheimer's disease and also for age-related cognitive decline, depression, ADHD, and improving athletic performance. Phosphatidylserine is a phospholipid that contains both amino acids and fatty acids. The omega-3 fatty acids EPA and DHA work synergistically with phosphatidylserine to provide the building blocks for healthy cell membranes. The human body can make phosphatidylserine, but it obtains most of what it requires from food. Phospholipids, which surround all of our cells, are essential molecules that provide cellular structure and protection. As a phospholipid molecule, phosphatidylserine structure is made up of 4 components: fatty acids, a platform to which the fatty acids are attached, a phosphate, and an alcohol attached to the phosphate. Phospholipids line up and arrange themselves into 2 parallel layers, known as a phospholipid bilayer. This is the layer that makes up your cell membranes and is critical to each of your cells' ability to function. Phosphatidylserine is critical to the maintenance of all cellular activity, especially in the brain. Some benefits of phosphatidylserine supplementation are for bone matrix formation, cell repair and removal by the immune system, heartbeat coordination, hormone secretion by the adrenal glands, and testicular function. Alzheimer's disease is a form of dementia that can rob people of the ability to think clearly, perform everyday tasks, and ultimately remember who they even are. Phosphatidylserine as a nootropic supplement may increase levels of brain chemicals involved with memory and improve brain cell communication. In a double-blind crossover study, people with Alzheimer's disease who took 300 milligrams of phosphatidylserine per day for 8 weeks had greater improvements in overall well-being than those who took a placebo, but there was no significant differences in mental function tests. Phosphatidylserine seems to be most effective in people with less severe symptoms. However, it appears that phosphatidylserine is less effective with extended use. A study published in the journal Aging evaluated the effects of 6 months of phosphatidylserine supplementation on 494 elderly patients with cognitive impairment. Researchers found that the phosphatidylserine produced statistically significant improvements in behavioral and cognitive parameters after 3 months and again after 6 months. In addition, the phosphatidylserine was well tolerated by the subjects. In a 2010 study published in the Journal of Clinical Biochemistry and Nutrition, 78 elderly people with mild cognitive impairment took soy-derived phosphatidylserine supplement or placebo for 6 months. After 6 months, subjects with relatively low memory scores at the beginning of the study demonstrated a significant improvement in memory, while the scores of the placebo group were unchanged. Studies show that patients with depression have compromised blood flow to a number of brain regions. Having an omega-3 deficiency is a health condition that can decrease normal blood flow in the brain. Omega-3 deficiency also causes a 35% reduction in your brain's phosphatidylserine levels. When someone is depressed, he or she is typically low in omega-3s as well as phosphatidylserine. It makes sense that an increase in phosphatidylserine intake through food and supplements can help to combat depression. Phosphatidylserine also affects the levels of neurotransmitters in the brain related to mood, and research has shown it can decrease the severity of depression. In a study published in 2015, researchers evaluated the effects of phosphatidylserine on 18 elderly subjects with major depression who experienced insufficient improvement from antidepressant therapies for at least 6 months. The subjects then took a supplement containing 100 milligrams of phosphatidylserine and 119 milligrams of DHA and 70 milligrams of EPA 3 times a day. After 12 weeks, all of the depressed subjects taking the supplement had significantly improved their scores on the 17-item Hamilton Depression Scale. Some research also points towards phosphatidylserine decreasing anxiety and stress by dampening the body's cortisol response. For the effects on cortisol control, doses from 600 to 800 milligrams per day have been used in studies. Parkinson's disease is a degenerative illness of the nervous system that can result in loss of intentional movement. Generally, those with Parkinson's lose the ability to speak properly, have difficulty walking, and may also experience tremors. There's no specific known cause, but people with Parkinson's experience a die-off of brain cells that produce dopamine, which is responsible for signaling to the areas of the brain that deal with movement. When these brain cells die, the brain starts to lose the ability to tell the body when and how to move, resulting in Parkinson's symptoms. Phosphatidylserine is key to proper brain function, and people with Parkinson's often have low levels of phosphatidylserine. In one study, taking 100 milligrams of phosphatidylserine 3 times per day improved mood and brain function in people with Parkinson's. In 2018, research using animal subjects demonstrates how adding phosphatidylserine to the diet of a Parkinson's patient may help with symptoms like poor sleep. Using a model of Parkinson's disease in fruit flies, the research saw that there was an improvement in sleep in the animal subjects in a matter of days after supplementing with phosphatidylserine. Attention deficit hyperactivity disorder, or ADHD, is one of the most common neurodevelopmental disorders of childhood. Children with ADHD typically have difficulty focusing and controlling impulsive behaviors, and they're overly active. ADHD can also affect adults. Scientific research has revealed a link between phosphatidylserine and cortisol regulation that may be especially beneficial for people with ADHD. For people diagnosed with ADHD, phosphatidylserine has been shown to help by increasing mental focus, promoting memory and cognition, boosting mood, and relieving stress through a reduction of cortisol levels. Phosphatidylserine has been shown to encourage increased brain activity through the neurotransmitters, thus improving the ability of ADHD sufferers to focus, control impulses better, and learn without becoming easily fatigued. A study published in the Journal of Human Nutrition and Dietetics wanted to figure out whether or not supplementing with soy-derived phosphatidylserine can improve ADHD symptoms in children. This randomized, double-blind study had 36 children, aged 4 to 14 years, who had not previously received any drug treatment for ADHD. They were to take either a placebo or 200 milligrams of phosphatidylserine each day for 2 months. The researchers found that supplementing with phosphatidylserine significantly improved ADHD symptoms as well as short-term auditory memory. They concluded that phosphatidylserine might be a safe and natural nutritional strategy for improving mental performance in young children suffering from ADHD. Improved athletic performance is another one of the many possible phosphatidylserine benefits. It's also been shown to decrease muscle damage while improving endocrine response to exercise-induced bodily stress. A 2007 study published in the Journal of International Society of Sports Nutrition evaluated the effects of oral phosphatidylserine supplementation on golf performance in healthy young golfers. Although findings weren't statistically significant, it was concluded that 6 weeks of phosphatidylserine supplementation improved perceived stress levels in golfers and significantly improved the number of good ball flights during tee-off. Another study looked at the effects of daily supplementation of 750 milligrams of soybean-derived phosphatidylserine for 10 days on active male cyclists. The main finding of the study was that phosphatidylserine supplementation significantly increased exercise time to exhaustion by 85% VO2 max. VO2 max is the maximum amount of oxygen that an individual can utilize during intense exercise. It's a factor that can determine an athlete's capacity to perform sustained exercise and is linked to overall aerobic endurance. This study demonstrates that phosphatidylserine has potential to enhance physical performance. Phosphatidylserine is considered safe when taken by mouth in appropriate doses. In most studies, it's been used for up to 6 months. Possible phosphatidylserine side effects, especially at doses over 300 milligrams, can include insomnia and upset stomach. You should not take phosphatidylserine if you take any type of blood thinner. You should also use caution when combining it with natural blood thinning supplements like ginkgo biloba. 4 things that are known to decrease phosphatidylserine levels are aging, stress, modern diets, and modern food production. Aging naturally increases the brain's need for phosphatidylserine, but it also creates digestive and metabolic insufficiencies, so it's simply not possible to get enough phosphatidylserine in your diet. Stress simultaneously increases phosphatidylserine requirements and decreases your phosphatidylserine levels. Modern production of fats and oils decreases their natural phospholipid content, including phosphatidylserine. Modern low cholesterol and low fat diets lack up to 150 milligrams per day of the dietary phosphatidylserine, while a vegetarian diet may undersupply as much as 200 to 250 milligrams per day. The highest dietary source is soy lecithin, which is derived from soybeans. Cow brain is the next highest source, but this isn't recommended as there's a possible risk for mad cow disease. Phosphatidylserine supplements for memory and other health concerns were made from cow brains, but there were many concerns that these animal-derived supplements could cause mad cow disease. Phosphatidylserine is now available as a dietary supplement derived from soy lecithin. It can also be made from cabbage or sunflower. This is an easier, safer way to reap the potential benefits of phosphatidylserine. Cognitive improvement is one of the many potential phosphatidylserine benefits, which is why phosphatidylserine is often marketed as one of the best memory supplements. For Alzheimer's disease and other age-related thinking or memory impairment, scientific research supports a dose of 100 milligrams of phosphatidylserine taken 3 times per day for up to 6 months. Some research has shown that phosphatidylserine seems to work best in people with mild Alzheimer's symptoms, but it may stop working after around 16 weeks. For mood, phosphatidylserine is typically taken with at least 200 milligrams of EPA and 200 milligrams of DHA. In another video, I show how EPA and DHA can also work synergistically with uridine and choline. If you have a chronic medical condition, or if you're trying to conceive, pregnant, breastfeeding, under the age of 18, or taking other medicine, you should speak to your doctor before taking phosphatidylserine.